Hello, everybody. I'm Nicolò Battisti. I'm a medical oncology consultant at the Royal Marsden Foundation Trust of London in the UK. I'm the president of SIOG, the International Society of Geriatric Oncology. I'm delighted to see that now we have the opportunity within ONCOassist to access more easily a number of geriatric assessment tools and frailty assessment tools that can inform our treatment decisions and discussion with patients in the clinic. There is now increasing a substantial amount of evidence that's been generated over a number of years, showing the broad and significant benefits of integrating frailty assessment routinely in the care of older patients with cancer. Whenever we consider systemic treatment, for example, like I do myself as a medical oncologist, but also local regional treatments like surgery. These evidence suggests that with frailty assessments, we can, for example, be much more accurate in predicting the prognosis of our patients, predicting the risk of functional decline on whatever drug treatments or local treatments we are considering for that specific individual. We can diagnose problems then that with routine considerations, such as simply, for example, performance status, may not be captured routinely in oncology clinics. But over the last 4 years, we've also learned that with the integration of geriatric assessments and multidisciplinary driven interventions, what we call comprehensive geriatric assessment, we can also improve key outcomes for our patients. For example, treatment tolerability with a reduction of severe toxicities on systemic anti-cancer treatments. We can prevent people from ending up in a hospital due to complications of the cancer treatment, so reduce hospitalizations and the use of healthcare resources. We can improve patients' quality of life, which is also a very important endpoint for our patients, regardless of whether they're receiving curative or palliative treatment for their cancer. There are guidelines now that are increasingly supporting the use of frailty assessments or geriatric assessment and driven interventions for patients undergoing cancer treatment over the age of 65 or 70 years. For example, the American Society of Geriatric Oncology guidelines that were updated last year, the National Comprehensive Cancer Network guidelines, the International Society of Geriatric Oncology, SIOG guidelines as well on geriatric assessment and geriatric screening tools. So these are really tools that we need to take ownership of using as medical oncologists, clinical oncologists, surgical oncologists. There is no longer an excuse to say, no, this is not my business. This is everybody's business, because a significant proportion of the patients that we see in the clinic are older or may have vulnerabilities and frailty that may benefit, require multidisciplinary interventions, and may have a significant impact on also cancer treatment outcomes. So again, I'm delighted to see that these tools are now becoming more easily available also for busy practicing clinicians like all of us, thanks to the fantastic work from the team at ONCOassist. Thank you.